are you? Good to see you again. I can see the medication has helped as well. Frontal density looks good enough. Strip scar healed pretty well. What are your goals? Do you have anything in mind?
I prefer the widow's peak to be brought forward a little bit. I don't want it.
One is the mid-frontal point. The other is the frontotemporal angle, and also the temporal peaks. But the most important are the 3 points. So in reference, the frontotemporal angle should never be lower than the mid-frontal point. So that doesn't exist in nature. If this hairline was lower here and this went downward, I would hate to see that. I would definitely say he was transplanted. It would look unnatural. It's both more natural this way and it's safer given you have advanced hair loss going backwards. So I would caution you against it. I wouldn't, if I had your hairline, I wouldn't want to lower it, but if I were going to lower it, I would lower it all the way to keep the same ratio between the frontotemporal angle and the mid-frontal point. Lowering the whole hairline, basically using most of the hairs to do that. So that would mean most of the hairs are being used to do this new hairline. So although strip and FUE are complementary in taking more donor hairs, FUE reduces the coverage potential of the remaining donor hairs as well.
Prefer to reduce
it. Good. So then it becomes an advantage. Yeah. But there's a threshold. So if you do it too aggressively, then you make it too thin, and now you have problems even covering your strip if you do that. But in our case, I don't recommend a very aggressive approach. And then you want beard hairs taken as well.
Feel excellent, and the quality is different, of course. But it's not. I'm not a man who has a huge. There are some men with a very, very, very different.
The scars are almost invisible. So now we can take more uniformly. An excellent result in hair surgery is an exception. People don't get that. They think it's normal to get a good result. It's not normal. And again, look forward to protect the excellent results instead of risking. Now, because if you lower the hairline, here are the things that happens. Number one is you use an important amount of donor hairs to make that new hairline. Number two is because you're transplanting an entirely hairless area, there's a higher chance that the new hairline doesn't look as dense as the previous. And so again, you've made it worse. Number three is that the more aggressive the hairline is, the more difficult it is to make it natural.